Assalamu alaikum everyone. Hope you're all doing fine. Inshallah, today we're going to discuss a rather brief topic, an interesting one. We are going to talk about the blood supply of the spinal cord. By the end of this session, you should be able to enumerate the feeders contributing to the blood supply of the spinal cord, the main arteries that are going to supply the spinal cord, in addition to understanding the origin of each feeder and the sequelae for its obstruction. The spinal cord is supplied with blood supply from three main arteries. The spinal cord, as you all know, starts from the uppermost part of the vertebral column, following the foramen magnum. The foramen magnum is the opening at the base of the skull. This foramen magnum allows the brainstem to exit from the cranial cavity towards the spinal cord, and from the upper cervical segments, this spinal cord spreads along the vertebral column till it reaches the end of L1 to L2 lumbar vertebrae, and then completes its pathway inside the vertebral canal as coda equina. The spinal cord is supplied by three arteries that run along its length. This length is from the cranial cavity along till L1 to L2, along with many arteries that approach through the sides of the vertebral column. The three longitudinal arteries are called the anterior spinal artery and the right and left posterior spinal arteries. The three longitudinal arteries supplying the spinal cord run in the subarachnoid space. The subarachnoid space is the place where the arteries of the nervous system can supply its content. We can see arteries within the subarachnoid space in the cranial cavity supplying the brain, the outer surface of the brain, and also in the spinal cord we're seeing arteries running at the same layer of the meninges in the subarachnoid space to supply the spinal cord. The longitudinal arteries that we mentioned in the previous slide anastomose with anterior and posterior segmental arteries present at this layer. But these anterior and posterior segmental arteries are derived from regional arteries, meaning that these are not the anterior and posterior spinal arteries that we mentioned earlier. They are coming along the vertebral column, entering the spinal cord at various points along its length, meaning that I can have some arteries entering the spinal cord along the cervical region, along the thoracic, lumbar, sacral, and coccygeal from outside the vertebral column, along with the three longitudinal channels, the anterior and the two posterior spinal arteries. The arterial blood supply below the cervical region comes from the radially arranged posterior and anterior radicular arteries. These radicular arteries are considered segmental arteries that we mentioned in the previous slide. These arteries run into the spinal cord along the dorsal and ventral nerve roots, so they enter in a transverse fashion into each spinal segment along its dorsal and ventral nerves. The intercostal lumbar radicular arteries arise from the aorta, provides major anastomosis and supplement to the blood flow of the spinal cord. So we are having longitudinal channels, anterior and posterior spinal arteries. We are having radicular arteries. We are having segmental arteries entering the vertebral column at various levels. Each group of arteries enters a specific spinal segment, supplying this spinal segment along the dorsal and ventral nerve roots. The largest of these anterior radicular arteries is called the Artery of Adenkivitz or Arteria Radicularis magna. This is one of the segmental arteries. One of the largest of these segmental arteries usually arises opposite the thoracic vertebrae number 11, and it provides a major blood supply to the lowermost part of the vertebral column, usually at the lumbar and the sacral parts of the vertebral column and the spinal cord. What we just mentioned is a small or a brief wrapping up for what we are going to see in details starting the next slide. For the first longitudinal channel, the first longitudinal artery that we talked about, it's called the anterior spinal artery. The anterior spinal artery comes by union of two small spinal branches of right and left vertebral arteries in the upper cervical canal. So actually it's not one artery, it starts with two, then unites to form one single artery. This artery runs caudally from the foramen magnum into the anteromedian fissure of the spinal cord, joins with the fellow of the opposite side to form the anterior arterial trunk. So it starts with two arteries within the cranial cavity as branches from the vertebral artery. Then they unite at the anteromedian fissure of the spinal cord and descends along its anterior surface. Where does this anterior spinal artery terminate? It terminates at the filum terminal. This is the end of the vertebral column. This is the filum terminal, which is formed by the pia mater surrounding the end of the spinal cord. At the end of the spinal cord, the area called conus medullaris, and from the conus medullaris comes off the pia mater that was covering the spinal cord till it attaches itself to the sacrum downwards. So the anterior spinal artery runs along the whole length of the vertebral canal, not just the spinal cord till it ends by L1 or L2 lumbar vertebrae. No, it completes its pathway till it reaches the filum terminal at the end of the vertebral canal. This anterior spinal artery supplies the anterior two-thirds of the cord. If we are looking at a horizontal section through a spinal segment, this anterior spinal artery supplies the anterior two-thirds of the cord. This anterior two-thirds includes the anterior gray column, the anterior gray commissure, and lateral gray column if we are talking about the thoracic region. It also supplies the anterior and lateral white columns with anterior white commissure. This is a cross-section taken at a spinal segment. As you see, this is the anterior aspect of the spinal segment. This is the anteromedian fissure, and this is the posteromedian sulcus. This is the anterior aspect of the vertebral or the spinal segment, and this is the posterior one. As you see, this is the anterior spinal artery. As we said, this anterior spinal artery is actually a branch from both vertebral arteries inside the cranial cavity. These both vertebral arteries each gives off an anterior spinal artery. They both unite with each other and descends as a longitudinal artery at the anteromedian fissure, supplying the anterior two-thirds of the vertebral or the spinal segment. As you see, it supplies both anterior gray matter into the ventral horns, supplies the lateral horn if present at the thoracic region, supplies the anterior gray commissure, supplies the anterior white commissure along with the anterior and lateral columns of the white ascending tracts. The anterior spinal artery syndrome occurs when we occlude the anterior spinal artery. Occlusion of the anterior spinal artery by thrombosis or compression of the anterior spinal artery can result in motor symptoms due to involvement of corticospinal tracts and the anterior gray columns, also with sensory symptoms present as bilateral loss of pain and temperature sensation due to the ischemia of the spinothalamic tracts. So the affection of the anterior spinal artery occlusion would affect the anterior two-thirds of the spinal segment, as you see, and this involves the cells present at the ventral horn of the gray matter, involving the anterior horn cells, so that causes flaccid paralysis of the affected segment. Also, affection of the anterolateral system present at the white column, anterolateral white column, would affect bilateral because the anterior spinal artery supplies both sides of the spinal segment, would cause bilateral affection and loss of pain, temperature, and impaired touch sensation due to the affection of the anterolateral system. For the posterior spinal artery, the posterior spinal artery branches from either vertebral or posterior inferior cerebellar arteries. Both also are present inside the cranial cavity. These two posterior spinal arteries runs down in the posterolateral sulcus, dividing into two collateral arteries, a medial and a lateral one along the posterior nerve roots. So they are originally two longitudinal arterial channels passing at the posterolateral aspect of each spinal segment, and at each segment these posterior spinal arteries even divide to give two collateral arteries, a medial and lateral one, going into the spinal segment along its posterior roots. Thus are 5 longitudinal arteries around the spinal cord. These arteries, reinforced by the segmental ones, form 5 longitudinal arterial trunks. This is the spinal segment. This is the territorial blood supply for the anterior spinal artery. As you see, these are the 2 longitudinal arterial channels splitted from the posterior spinal artery, going along the posterior root of the dorsal root of the spinal segment. And as you see, we've got a red mark at the spinal segment showing posterior and anterior radicular arteries, or what we call the segmental arteries that we described earlier. These are arteries entering the spinal cord along its course at different anatomical territories to supply and reinforce the blood supply of the spinal segment. So if we count the longitudinal channels, we have got 1 anterior spinal artery and 2 out of the posterior spinal artery, 2 longitudinal channels along the dorsal root of the spinal segment. So in total, we are having 5 longitudinal arteries or 5 longitudinal arterial trunks supplying the blood supply of the spinal segment. This is a more detailed picture. As you see, this is the spinal segment. This is the segmental arteries running along the spinal nerves. These segmental arteries enters the vertebral column at different anatomical regions. This is the anterior spinal artery. This is a single arterial trunk coming as 2 from the cranial cavity, splitting from the vertebral arteries, then uniting once again to descend at the anteromedian fissure. These are both the posterior spinal arteries. We said that they either come from the vertebral or the posterior inferior cerebellar. These posterior spinal arteries give 2 further longitudinal arterial trunks that runs along the dorsal horn or the dorsal root of the spinal nerves. So in total, we're having 5 longitudinal arterial trunks surrounding the spinal segment. Once again, this is a further image for the previously seen spinal segment. At this one, we're seeing the vertebral column, the vertebrae, at the different anatomical regions. This is the aorta, and these are the segmental arteries entering towards each spinal segment. These are the branches entering the spinal segment along the dorsal root of the spinal nerve. These segmental arteries anastomose with either the anterior and the posterior spinal arteries to reinforce the blood supply entering the spinal segment. These posterior spinal arteries communicate around the cord, meaning that they anastomose with each other and with the anterior spinal artery, forming what we call the arterial vasa corona or Arteria Corona. This arterial vasa corona are small superficial blood vessels coming from the anastomotic longitudinal channels to supply radially the periphery of the spinal segment. This posterior spinal artery supplies the posterior 1/3 of the cord because the anterior 2/3 were a sole territory for the anterior spinal artery. So it gives the posterior gray column with the posterior gray commissure, because the anterior gray column and the anterior gray commissure was supplied by the anterior spinal artery. It also supplies the posterior white column at this area. This is once again a picture for the spinal segment. This is the spinal nerve. This is the dorsal root. This is the ventral root. This is the motor one, and this is the sensory one. This is the dorsal root ganglion. As you see, we are seeing the arteries, the main arteries supplying the spinal cord. This is the anterior spinal running at the anteromedian fissure. These are the posterior spinal arteries going at the posterolateral sulcus. And these are the segmental arteries entering along the roots of the spinal nerves. As you see, there is an anastomotic channel between all the arteries surrounding the spinal segment. This is the Arteria Corona, as we just mentioned. These are small, radially arranged superficial arteries entering the spinal segment from the periphery, supplying the content of the spinal segment. If we're going to mark the territory of the posterior spinal artery, it would be the posterior 1/3 of the spinal segment, including the posterior horn of the gray matter, also the posterior white column. This area is occupied by the dorsal column, the one that perceives our proprioceptive sensation. In addition to the anterior and posterior spinal arteries, we mentioned that we've got segmental arteries, and we describe these segmental arteries by being a group of arteries entering at each spinal segment at different anatomical regions. So we are having arteries coming from the deep cervical area, ascending cervical arteries, intercostal, and lumbar arteries. These are all the parents for the branches coming as segmental arteries to supply the spinal cord. They reach the cord as anterior and posterior radicular arteries along the corresponding roots of the spinal nerves, respectively, and nourishes the root, the nerve root, as we just saw the previous picture. The anterior radicular arteries are usually larger and less in number, while the posterior ones are smaller and more numerous in number. The great anterior medullary artery of Adenkivitz, or the Arteria radicularis magna, is one of the anterior segmental or radicular arteries arising opposite to the aorta at the thoracic vertebrae number 11, usually arises unilaterally to the left side and contributes to the major blood supply of the lower half of the vertebral column. The lower half includes the lowermost part of the spinal cord, in addition to the coda equina, the group of nerves running into the vertebral canal to reach the sacral and the coccygeal vertebrae. This is a diagrammatic representation for the arterial supply of the spinal cord. As you see, this is the aorta at different anatomical regions, and these are the segmental arteries that we mentioned reaching for the spinal cord along the spinal segments. These segmental arteries divide with the rootlets of the spinal nerve, going into the Arteria Corona surrounding the spinal cord, anastomosing with the anterior spinal and the posterior spinal arteries, giving these small radial arteries to supply the periphery of the spinal segment towards its center. The anterior arterial trunk is formed by union of the two anterior spinal arteries arising from the vertebral arteries and a branch of the Arteria radicularis magna, the one that we've just mentioned, the Artery of Adenkivitz, whereas for the posterior spinal trunk, it's formed by two posterior spinal arteries and along with the posterior radicular ones. These anastomotic arteries form 5 longitudinal channels that we said are being present around the spinal segment. One of them is formed by the anterior spinal. The others are formed by the two collateral branches coming off the posterior spinal arteries, with the segmental arteries anastomosing with them. Another diagram showing the segmental arteries supplying the spinal cord. As you see, they are running along the aorta, coming from different anatomical regions, even from the cervical area through the deep cervical and ascending cervical arteries. Then at the rest of the spinal cord, they are supplied by segmental arteries coming directly from the aorta. As you see, these segmental arteries enter between the vertebrae of the spinal cord, the vertebrae of the vertebral column towards the spinal segments, along with the spinal nerves. The importance of these radicular or segmental arteries comes from being a major contributor to the blood supply of the lower half of the spinal cord. The upper half of the spinal cord depends upon the anterior and the posterior spinal arteries, wherefore the rest of the spinal cord till the end of the vertebral canal, it relies mostly on these radicular and segmental arteries. The problem is that these arteries are end arteries, so if I'm blocking anyone with a compression, with a thrombus, I'm usually causing a damage to the corresponding part of the spinal segment. So they are very important. Any block at any one of them would cause a permanent damage to a part of the spinal segment that is supplied by this segmental artery. Impaired blood flow through these critical radicular arteries, especially during surgical procedure that involves abrupt disruption of blood flow through the aorta, for example, during aortic aneurysm repair, can result in spinal cord infarction and paraplegia. Again, this is a diagram showing the blood supply of the lower half of the spinal cord. This is the vertebral column, this is the aorta, this is the segmental arteries supplying each of the segments of the spinal cord, and this is the anterior, and those are the posterior spinal arteries. As you see, we mentioned earlier that the Artery of Adenkivitz is one of the segmental arteries coming usually opposite the thoracic vertebrae number 11. This Artery of Adenkivitz comes from the left side of the segmental arteries and usually somehow replaces the anterior spinal artery or completes the anterior spinal artery to supply the lower half of the vertebral column along with the coda equina. It's a very important artery. It's a continuation of the anterior spinal artery. It supplies most of the lower half of the spinal cord and the coda equina. Again, this is the diagram for the blood supply of the spinal cord, either from the segmental arteries or the anterior and the posterior spinal one. The veins of the spinal cord drain into 6 tortuous longitudinal venous channels that communicate superiorly with the skull veins and the venous sinuses inside the cranial cavity, and the part of these longitudinal channels anastomoses inferiorly or drains inferiorly into the veins of the draining segmental arteries. For the venous drainage of the spinal cord, we've got 6 longitudinal venous channels. 2 are present at the median plane. One of them is present at the anteromedian fissure, and the other one is present at the posteromedian sulcus. Those are 2 median longitudinal veins. We've got 2 other anterolateral ones. They are present in relation to the anterior nerve roots of the spinal nerve, just posterior to it. And another 2 posterolateral nerves, venous drainage channels, one on each side of the posterior nerve root. So I'm putting venous channels along the anteromedian fissure, the posteromedian sulcus, and I'm putting other venous channels along the anterior nerve root and the posterior nerve root, just posterior to each of them. So in total, we're having 6 longitudinal veins. These longitudinal venous channels, as we said, communicate with the uppermost part of the spinal cord inside the cranial cavity, and below they communicate with the segmental arteries and their venous drainage. So the uppermost part of the spinal cord, the internal vertebral venous plexus, it's a plexus of veins surrounding the vertebral column, the vertebral canal, and the spinal cord within the subarachnoid space. This internal vertebral venous plexus communicates above with the basilar venous plexus. This is one of the plexuses, the venous plexuses inside the cranial cavity that would eventually drain into one of the sinuses of the brain. Below, the internal vertebral venous plexus drains into veins corresponding to the segmental arteries. So they drain into either vertebral, posterior intercostal, lumbar, or lateral sacral veins, and these are systemic veins outside the vertebral canal corresponding to the segmental arteries that just entered into it. This is a diagram showing the arterial and the venous system supplying and draining the spinal cord. As we see here, this is the anterior spinal. These are both the posterior spinal arteries. This is the Arteria Corona surrounding the spinal cord, supplying it from the periphery. These are the segmental arteries, and these are the venous channels surrounding the spinal segment. We've got a vein at the anteromedian fissure, posteromedian sulcus. We've got 2 venous longitudinal channels related to the posterior root of or the dorsal root of the spinal segment. We've got 2 other venous channels corresponding to the anterior or the ventral root of the spinal segment. This is also another representation for the longitudinal venous channels. We said we've got 6. surrounding the spinal segment. They communicate superiorly with the basilar venous plexus and then to the cranial sinuses to drain the blood supply. At the lowermost part of the spinal cord, the internal vertebral venous plexus drains into the segmental veins, going to veins corresponding to the segmental arteries supplying this spinal cord. So, to wrap up our discussion for the blood supply of the spinal cord, we'll just mention the affection if we close one of the main blood supplies supplying the spinal cord and the spinal segments. They are collectively being summoned into two syndromes. The anterior spinal artery syndrome, as we just mentioned earlier, it includes back of the neck pain of sudden onset, rapidly progressive flaccid and areflexic paraplegia. Paraplegia means paralysis in both lower limbs, loss of pain and temperature to a sensory level, preservation of proprioception, vibration sense, and urinary incontinence. This preservation of the proprioception and vibration sense because of the sparing of the dorsal column tracts, the ones carrying the proprioceptive sensation, urinary incontinence due to the affection of the lateral horns of the autonomic nervous system at the thoracic region if present. For the posterior spinal artery syndrome, we've got loss of proprioception and vibratory sense. That's logic, because the posterior spinal artery supplies the posterior 1/3 of the spinal segment, and this area is occupied by the dorsal column carrying this sensation. We have preserved pain and temperature sensation. This is because the anterolateral system is spared, being supplied by the anterior spinal artery. We have loss of stretch and cutaneous reflexes below the involved segment. We have absence of motor deficit because the anterior horn are spared and are supplied by the anterior spinal artery. At the end of our lecture, I just hope that the content of the lecture was convenient. For any inquiries, for any question, just contact me at any time and I'll just reply as soon as possible, inshallah.